Good evening, and on the show tonight we speak about hypertension as the world commemorates this day, Monday the 17th of May 2021, and this is an annual celebration to just raise awareness on this disease that could even pose a risk to some heart complications, liver and even kidney. Welcome to this show, and my guests tonight we have Dr. Yubrin Mora, who is a physician. She will be telling us, talking more about what this disease is all about, what are some of the treatment options, and also the preventive measures and the cost effectiveness of hypertension in the country. And also on the show tonight we have Stephen Morocco, who is a patient of hypertension, to share with us his experience as a patient. And of course we know that people with underlying conditions have been on the spot, especially with the COVID-19 and also the cases of the comorbidities among these groups of people on the rise. So we also get to hear the fears that the patients have in the country. Once again, welcome to the show. And of course, Dr. Mora, it's good to have you as usual to this discussion tonight.
Thank you so much, Purity.
So welcome to the show, Stephen. It's also glad to have you with us here tonight.
Thank you. Good evening.
Okay, let's begin with you, Dr. Mora. Maybe we are celebrating this day. Is it an important day because it has been there have been concerns, especially on the people living with underlying conditions and COVID-19, and a lot of fear among this group of people? Probably as an expert, you'll be saying that it will not come at a better day, right?
Definitely, Purity. But again, let's not forget that we're not going to just celebrate on Monday. We have been commemorating the entire month. The month of May, the whole of it, is what we refer as the May Measurement Month, where we normally want to screen as many patients as possible to know their status about how their blood pressure is globally.
Yes. The World Health Organization estimates that there are about 1.13 billion people with hypertension. Maybe you can tell us how big of a problem is hypertension in Kenya?
Same picture. Remember, in Kenya right now and in Africa at large, we are experiencing an epidemiological shift, meaning our kind of diseases that we are dealing with initially, which were communicable diseases, including TB and malaria, and other infectious diseases, were the issue that we were dealing with in the 20th century and before that. But now we are seeing that these diseases are, the non-communicable diseases are shifting to our side now. We are seeing a rise in obesity and lifestyle-related diseases and cancers and respiratory illnesses. And majorly, cardiovascular diseases are contributing the biggest chunk of this rise in these NCDs. And now that describes the epidemiological shift we are seeing, and as Africans and as Kenyans, we are shifting our lifestyles, adopting and aping more of the Western kind of lifestyle. And these diseases are here with us now, and they are here to stay, and we have to really face the elephant in the room with us right now.
And there's a way we can, of course, prevent and protect ourselves from getting some of these diseases. Right, we'll be talking more about that. Let me speak with you, Morocco. Maybe you can share with us a little bit of your experience when you are diagnosed with hypertension, and what are some of the things that did you feel sick? What are some of the symptoms that you had before the doctors could say it's hypertension?
Well, thank you. I think I started with I became diabetic in 1998, and 3 years down the line, the high blood pressure was diagnosed with me. The symptoms were persistent headache. There was also loss in weight. The heart was beating a bit higher, and it was persistent heartbeats. And then I visited the doctor, and I was diagnosed with hypertensive.
And maybe did you, before the diagnosis and when you were experiencing these symptoms, did you have an idea that it could be one of these non-communicable diseases? Did you have any background knowledge about hypertension?
Actually, there was no clue. You see, this hypertensive doesn't pain. The normal, like, headache, you just think it is a normal headache. You just go over the counter and buy the Panadol You go back home, it persists. You just think it's the problem that you could be undergoing, but it is a serious disease because it doesn't have signs, symptoms. And most of our people do not visit doctors periodically to check their medical status. So you can stay with that, you can work with it, you can live with it for many years before it's diagnosed to you. Otherwise, once you know it, it is manageable with the advice of the doctor and the drugs that you get, it is manageable. But the problem is to discover that disease. Yes.
And when you say that there are no symptoms, it's a bit confusing because I was almost asking Dr. Mora, what are the symptoms for hypertension?
I think I'd like to interject there and really emphasize what our gentleman has mentioned about lack of symptoms. And that's why we call high blood pressure and as a silent killer. It's a silent killer, and we all underline the word silent because by the time a patient is presenting with symptoms, you already as a medical provider, you're going to offer treatment for complications. You're not going to be treating the disease itself. And I think together with the Kenyan Cardiac Society, the Ministry of Health, there's been a lot of effort to try and create awareness. As I mentioned earlier, we have the May Measurement Month. And for the previous 4 years that we've done this screening, we've found out that 25% of patients have high blood pressure. And if we are a country of 50 million, Purity, your guess is as good as mine, that the number is really big. And unfortunately, out of that 25% of Kenyans that have high blood pressure, we have up to 70% that are not well controlled. And up to another, if out of that 50% don't even have access to medication. So we are dealing with a really big thing. And the emphasis I'm trying to make here is that it's a silent disease with silent presentation, and someone will hardly know. So the annual screening and us changing our health-seeking behavior to be more prone and more proactive towards going to check our blood pressure and our sugars, at least annually, is something that we really need to emphasize.
And does this mean that the symptoms present themselves maybe, if I may say, at an advanced stage when maybe the complications are now, because I understand it affects even the heart, the kidney. So what would you say are the symptoms really for high blood pressure or hypertension?
So precisely the point, Purity, you're saying that by the time someone is presenting with symptoms, you're already dealing with complications. And these complications will include heart complications where people can have symptoms of heart attack, including chest pain. Our gentleman mentioned earlier about having abnormal beats, which is something we call palpitations. Their heart is racing so fast. And other symptoms like swelling of the legs. They're coming in with symptoms of kidney failure, which will include swelling up. They're not passing urine well. Some of them present with stroke. And at this point, they'll come in maybe with weakness on one side. They can't move their hands or their feet. And sometimes they come in with sudden onset of blindness. And already now you're dealing with complications on the eye. So we don't really want to get to the point where someone is coming in with symptoms of hypertension, which is essentially symptoms of the complications of hypertension. We need to catch people early at the point where they really just complain that they are tired or they have a slight dull, vague headache, which essentially is just the body trying to say that everything is not correct. Yes.
And Stephen, how would you describe your diagnosis? Would you say it was made early enough, or for you went to the hospital while already sick?
Yes, I was lucky a bit because I was attending clinic for diabetes. And when I complained to my doctor and I gave him my feelings, that's when he discovered that I was having high blood pressure. And you know, high blood pressure and diabetes, they are just a sister and a brother. Once you get the diabetes, definitely after some down the line, you'll get hypertension. Yes. So it was easy because I was attending clinic, and we were taught symptoms of various diseases that related to the diabetic. And then that's when I was discovered with it.
And Dr. earlier on you had mentioned lifestyle, as the main cause of hypertension, but would you be specific on, because I know many people are asking themselves, so what causes this high blood pressure? You know, is it stress or, or even other illnesses? Because we also, Daktari, had cases of people diagnosed with COVID-19 and they end up having high blood pressure.
Very important question there, Purity, and I think it will take us back to understanding really what are the classifications of blood pressure. You can have blood pressure which we call primary hypertension, which essentially tends to happen and is very related to lifestyle, though there's a genetic predisposition, like if someone has blood pressure in the family, your father, your mother, so maybe your risk is higher. And if you compound that with the environmental factors like obesity and lack of physical activity, high salt intake, elevated cholesterol, and other diseases like diabetes, which make someone prone to high blood pressure because of the effects on the kidney, then your risk is higher. Then remember also there's hypertension, which is secondary, meaning it's been caused by other causes. And most of the time it's hormonal causes like adrenal hormone problems. You can have issues with thyroid hormone problems, something as much as like pregnancy bringing up the blood pressure. You can see someone with some things like polycystic ovarian syndrome, which essentially is like some insulin resistant sort of characteristic disease, which comes in and it increases the risk of someone having blood pressure. And it's important when you go to see a provider, and that emphasizes the point where blood pressure can happen at any age. Even children have been seen to have blood pressure from kidney diseases. As we know, kidney disease is one of the commonest contributors to issues of secondary hypertension. So at any age, I think when someone presents to the provider with an elevated blood pressure, right from children to adults, I think the first question as a doctor or the provider who's seeing this patient is, what is the cause of this blood pressure? So that if it's a cause that is secondary, then it means if we contain the issue that is bringing about the blood pressure, then we are able to control the blood pressure. But if it's primary, it means then the other factors, as I mentioned, genetic predisposition and all those other things that come into play, and this sedentary kind of lifestyle that we've adopted and makes us feel like we've really made it in life, that is contributing to all these things, and something very important called like metabolic syndrome, where we are big, we have diabetes, we have blood pressure together, and then we snore at night very heavily. All those things pile up. And something I want to emphasize very, very strongly is the use of medication, over-the-counter medication, like using drugs that are painkillers called non-steroidal anti-inflammatories. These drugs are like diclofenac, aceclofenac, those drugs that treat what people like to refer to as arthritis. So they take those drugs so often that they don't realize that these drugs are hitting their kidneys, and eventually when the kidneys are affected, the blood pressure goes up. So it's nice to know even the drugs you're taking, whether they have been prescribed by the doctor, before you make it a habit, a habitual way of living.
And let's talk about the treatment options, but after this question too. Stephen, you mentioned that the hypertension, it can be managed. Maybe you can tell us what are some of the lifestyle changes that you had to make after you were diagnosed with hypertension?
Well, you can, the first thing is medicine. The other is doing some exercises that possibly you are not doing them before. If you increase your exercises, if you lose your weight, balance your weight, although mine is still persistent. You lose your weight, it can help you.
Okay, so on the weight issue, we'll be coming back to you.
You see, with the weight, I think a doctor can tell us.
It's a journey.
Some of the drugs that we take, diabetic drugs, I think they increase appetite.
No, that is true. That's
and
right.
They increase a lot of appetite, and they also increase weight. I don't know why. I've been trying to lose my weight, and the much I can lose is only 2 kilos per month.
He brings a very important point that some of the reasons why we put on weight and all those things can be attributed to not just lifestyle choices in terms of how we eat, but also some drugs make us put on too much weight. And the drugs for diabetes, especially the injections, are known to actually make patients put on weight. So normally for us as clinicians, it's normally a delicate balance between making sure that you contain the doses of the drug and the patient is using still incorporating lifestyle modification and trying to see, there are also some other drugs that are used in diabetes that actually help with weight loss. So it's normally a balance we do, and that's why we encourage patients that we really have to follow you up and be able to go through the journey together with the patient. Yeah.
And is it curable, Dr. Mora?
The hypertension.
Yeah.
So hypertension, initially I think we should have highlighted that hypertension is a chronic condition, meaning that it's a condition that results from either the vessels not complying so well and other causes, as we said, like secondary causes are coming in. So normally if the cause is secondary, meaning it is a cause that we can identify, like let's say it's thyroid disease or it was adrenal disease or there was something that we really picked that caused the high blood pressure, most of the time when we deal with that issue, the blood pressure improves. But when it's a primary cause, then it's a chronic state, a chronic condition that someone will have. But having said that, sometimes as we say that lifestyle is a big component to high blood pressure, most of the time patients who are highly motivated, they lose weight, they exercise, they stop smoking, they are very active and they're motivated enough, we can put them off medication such that they're controlling the blood pressure with lifestyle. Because lifestyle is also a treatment. But normally we don't tell you that we are curing the disease. What we say is that we are controlling and containing the disease.
Right. Okay. And Stephen, kindly just tell us how affordable is the treatment for hypertension, because even the doctor is talking about we can only control. So is it like are you on medication for a lifetime? Is there a specific duration for the medication for hypertension? Maybe you can enlighten us more about that, Stephen.
I think it is a lifetime.
Yeah.
And the drugs are damn expensive. So it is an expensive exercise because the doctor keeps on changing your drugs. There are times when you get drugs, to a certain time, they are unable to control the disease. The doctor changes the drugs, and some of them are very expensive. And for a patient to have that kind of a disease, you have to incur a lot of money. So it is a very expensive, and it is a lifetime disease.
Yeah.
Yes.
Dr. Mora, who is at a risk of getting hypertension? Because from statistics, it seems to be more common among men than women.
Actually, the epidemiological studies that have been done we know the risk factors that exist for people with who are more prone to have hypertension. They're the ones we call modifiable, the ones that we can change, and those are entailing most of the lifestyle choices we make, from smoking, excessive alcohol consumption, excess weight and obesity, and people who have sedentary lifestyle with physical inactivity and use of some medication that can take the blood pressure up. Whereas for the non-modifiable one, what you're talking about is gender. Men are more prone to have high blood pressure. Age, the older you get, the more prone you are to develop high blood pressure. And other factors like race. Actually, it's been found that blacks are more likely to have a high blood pressure than the Caucasians. And other things like even psychological stress, and even some genetic components that have been shown in some other conditions coexisting, like having diabetes and all those things that can exist that can still make someone be more prone to developing hypertension, which are now the risk factors. But now, most importantly, is the ones that we say that the modifiable ones. We really need to make sure we work on the ones that we can modify so that we decrease the risk of someone developing high blood pressure.
Yeah. Maybe you can take us through that, the modifiable ones?
So those modifiable ones is if you're smoking, if you stop smoking, your risk goes down. If you're overweight, if you lose weight, your risk goes down. If you have diabetes, your diabetes is controlled well, your risk goes down. If you have sedentary lifestyle, meaning you have no physical activity, if you actually increase your physical activity. And I really, really pity us, because way back we used to be people who are going to the farm. Nowadays we just sit on the couch and watch TV, and with this age of working from home, people are doing nothing. So your risk even increases. So get out of the house, walk at least 30 minutes a day, 3 times a week. Make sure you sweat, you're walking, brisk walking, that's good enough. And the other things like making sure that you don't buy over-the-counter medication for pain, and making sure that you don't use medication that have not been prescribed to you. Those are some of the things we can deal with. And also making sure your diet, because remember, diet is what we do every day. So diets high in cholesterol, high in saturated fats, those kind of diets increase your cholesterol level, which gets deposited on your blood vessels and increase your vascular resistance, which ultimately causes hypertension. So modifying our diet into a more balanced, actually just going back to our roots as Africans on how we used to eat, but just cutting down on the starch and making sure that we don't use too much of processed meats and high salt intake. So those are some of the things we need to deal with in diet and the other issues that can really help us as a nation and as a region. Yes.
And Stephen, let me get back to you. As a patient, maybe what are some of the concerns do you have? Because it's already clear that people with underlying conditions are at a risk of developing complications, especially when they contract COVID-19. How are you faring on with that and the concerns that you have as a patient?
Actually, that's a very good question. It's very scary. And actually, those people are one of them. I'm one of them with underlying conditions, two of them, hypertensive and diabetic. I got the first injection, and I thought I was okay. The other one, I was supposed to get it on 25th of this month. The rumor has we are not going to get it.
You're talking about the
and
vaccine?
with our condition, to get the second, because that drug is no longer here coming. And we hear there are some counties where they are holding those drugs. We were discussing, why don't they bring those drugs to those people who are willing to get the second injection, rather than getting expired? They will get expired down there. So we are very scared. And more we get scared, the more the condition gets worse. Because this disease does not want you to, it wants you to be happy always, doesn't want you to overthink, it doesn't want you to have stress. Right now, our condition is getting even worse. And it is our cry that the government should consider those people with underlying conditions to get the second injection, because we are willing. Because even if I don't get it, I can die with the condition I have. So I better get the injection. That is our greatest worry. Yeah.
Okay. I'll get back to you shortly, but Dr. Mura, how important it is to have early screening, you know, regular early screening for hypertension, and what does it mean if it's late diagnosis?
They say prevention is better than cure, or we say prevention is better than cure, and maybe it will keep us out of business, but that is the kind of country that we want, where maybe we are not even saying, because right now we are still battling to try and screen and get our actual statistics. Maybe if we went back to the primordial prevention, where we have government policies that ensure that the salt content of snacks sold to children are this amount, or even the salt content on processed meat in this country is this amount, that's the farther that we want to go. I know we've really worked on the smoking, public smoking policy, and but I don't think that it's really followed stringently so that passive smoking is also taken care of. And also to just try and work on those risk factors that ultimately down the river, they really get to affect our population. But yes, now that we are at the primary prevention level, I wish we could go to the primordial prevention. At the primary prevention level, we are trying to screen, and screening is better than actually dealing with complications. Then we get to catch these diseases early. We get to advise people on lifestyle change. We get to put patients who need medication on the right medication and ensure accessibility to care and quality care in this regard. Then we will ensure that we decrease the cardiovascular mortality and morbidity that we see in different health setups. And that will ensure that our country is healthy, because if we lose Dr. Mora to high blood pressure, or Purity, we lose you because you got a brain bleed, we're already losing someone who would really make a big difference in this country. And so we really need to sit down on the table and think very deeply about our priorities. Yes.
And of course, the fact that, as well put by Stephen, that it's a treatment is an expensive affair should be another reason why early screening is recommended, right?
Yes, the health economic burden on the country will definitely go down. This government expenditure on healthcare will go down if we really, really put most of our efforts on prevention than curing, whereas we're also just losing talent and human resource. We're also losing resources trying to treat our people. Yes.
Okay, Doc. And Stephen, allow me to ask you, with the times of COVID-19, there was a time that reports were coming out that patients are shying away from going to the hospital because of the risk there is contracting COVID-19 at health facilities. How, maybe, is there any difference that you've been able to see, or experience while accessing the treatment for hypertension as a patient?
Yes.
Like accessibility of the treatment and the drugs for you. How is it like during this time?
There was a time when we could not visit the station in the hospitals because we were scared that once you visit the hospital, you could easily get it. We almost stayed 2 months without getting drugs. Where we used to buy them, they were not available. The hospitals were closed, like Westland. Our clinic is at Westlands, where we normally go for our drugs. So for the first 2-3 months, we had a problem, but right now it is solved. Yes.
Okay, and as we mark Hypertension Day tomorrow, Monday, maybe, what's your one call as a patient?
My call is to the government. These two diseases, hypertensive and diabetic, should be declared a national what?
Disaster.
A disaster.
Or health emergency?
Because, like in my clinic at Westlands, if I look at the patient, most of them have never even been employed one time, that they have retired. No. They're the people who go hustling around. So for those people to get drugs, it is a problem. And they must take the drugs. So it's now government to come in and assist. Like they are assisting patients, AIDS patients, the diabetic and hypertensive patient should be declared in the same category. That's my worry and my request to the government.
Yeah.
It should be declared a national disaster.
Okay. Doc, we are winding up. Maybe I'm welcoming your winding remarks, and also 25% that you mentioned, it's quite a huge number. Where is the gap and what ought to be done to stop this? Because 25%, honestly, it's huge,
I think we just need to sit down as stakeholders and policymakers in this nation, right from the patients to the policymakers up there. And I think we need to really come up with a plan that will work for us as a country. And I'm really grateful that now we are giving health the importance and the emphasis that it needs to have as an important pillar of national security. So it's time, and it's a wake-up call for all of us to sit down and actually come up with a plan on how we will do our primordial prevention right from policy level, and how we can decrease the number of childhood obesity in this country that we're witnessing, right to teenage obesity and young adult obesity, how we will control our smoking and excess alcohol intake amongst our youth, and how we will make sure that we ramp up screening programs and screening centers across the nation so that people can just walk in and know whether they have high blood pressure or not. And still in that spirit, as my colleague was mentioning here, that we need to make sure there's accessibility of care and availability of drugs for all patients, regardless of their social status. And I think that calls on the government to make sure that the NHIF or any health financing program can be put in place to ensure that drugs are available, and still in the same spirit, make sure that we are screening our people at every level.
Okay, thank you so much. Dr. Ubrin Mora and Stephen Morocco, thank you so much for being part of our show tonight. It's highly appreciated.
Thank you.
Okay, and that's where we wrap it up here on Family Matters Show. Thank you for watching. Thank you for your company. I'm Purity Museo. Have a lovely night and God bless.
Thank you.